Hi, I'm Kyla Epstein with Sumerick & Associates. On today's episode of Working Moms, I have Dr. Allison McFarlane joining me today. She is a chiropractor at Back to Function who's been working here for 5 years. And she has little Edison Bell at home who's almost 10 months. So thank you so much for joining me.
Thanks for having me.
Do you want to just tell the viewers a bit about your journey and how you got to be here?
Yeah, so I grew up in Peterborough. I played a lot of sports growing up, so I knew I wanted to go into the healthcare field, so getting into chiropractic was a pretty natural fit. My husband is Spencer Bell, so we came to Bell Chiropractic after graduation and never looked back since.
The rest is history.
Yeah, exactly. Now we have Edison.
So who would you say inspires you?
I wouldn't say there's one specific person that inspires me. I would say that there's a collection of ladies that inspire me. I find it really inspiring solo moms. Like after having a baby, have no idea how solo moms do it, which I know a few. Anyone that's going through any hardship, like people, who are dealing with illnesses and also have a child, I find that incredibly inspiring as well. Just, having so much on the go, stress can affect things like, obviously your milk supply and whatnot like that. So I just find things like that is like, some people are just so strong. It's very inspiring.
So how would you say your journey has been now as a mom working compared to before? I mean, we had all the time in the world before our little ones.
I always found like I was busy, but now that you have a child, it's like, okay, no, I am busy now. And I'm sure when you have a second child, you're gonna be like, how? I had so much time with just one. But yeah, I would say my journey it's been really nice, being self-employed. A lot of people say like, oh my God, you have to go back to work so quickly, right? Like 4 months, 5 months, 6 months, most people are heading back to work. But I actually find it pretty nice because you can wean back in and you can slowly just get your feet wet. Whereas with some jobs, I have some friends who are nurses and they're going back to work full-time, 12 hours, overnights, right away, right? Where I find it's really nice to just wean back into things and then just slowly develop some new routines.
That's a great point, because my first maternity leave was a year off, and then you just jump back in and it's really hard because you lose your identity a bit.
Yeah.
And now this mat leave, I'll be self-employed similar to you, so it's good that I have you to kind of lean on for the weaning back into things. Weaning.
Yeah, exactly.
So that's a great point. So I guess kind of slowly getting back into it, have you felt mom guilt? I mean, I think we always do, but could you elaborate? And
to be honest, I didn't feel like I lost my sense of identity, maybe because it was so quick. I more so, if anything, feel the mom guilt for my dog because he's on the back burner big time right now. But no, you definitely do feel mom guilt sometimes. I think more so actually when I'm there, because there's so much going on that sometimes when I'm playing with him, I hear my phone and I grab it and I'm texting or trying to organize something, and then like sometimes I look and he's looking at me like, Mom, what are you doing? So I find I get it more then, I don't ever really have it when I'm gone. Again, I'm not sitting at a desk kind of thinking about him all the time either. My job is I'm seeing people and going and it's quick, so maybe I don't have time to really think about it. But I do know too, when I'm working, like it has to be done, and there's a lot of people relying on me, and he's my baby and he needs me, but so do other people, and I know that being away from him will help when I go back and see him, right?
And you're doing it for him.
Yeah, exactly.
At the end of the day. So
yeah,
that's a good point. So who would you say has helped you get back into kind of mom, but also doctor shape?
Yes. I have to give a huge shout out to Taylor Bazinet at Peak Performance, because he has supported me so much in getting back to fitness in order to work. Our job is quite physical. But he is so understanding with Edison. If Edison even makes a peep, he goes over and he's grabbing him and he's carrying him around. He's so understanding and supportive. Our daycare lady is also amazing. Like she comes to us and she's just very understanding as well. You know, nothing is too big of an ask. And my friends have been great too. Like they aren't, if we're meeting at 10, it's a hard 10. They are, they understand that the kids kind of make the schedule up, and if you're meeting at 10 and usually that's a good time to meet, they know, and it's like, it's not going to work out that one time that you're trying to meet them. So they've been really good too. And when I was, like before I had Edison, I was a little bit worried about, people talk about this comparison and jealousy between moms, and I feel like we don't have that at all. And it's like a really honest group of people, like, texting and telling us about their night, whereas some people are just, they try and just tell you all the good things about motherhood and
like social media.
Yeah, exactly.
It's hard. Motherhood is hard.
Oh yeah, for sure. So they're really honest and totally like accepting of things and help out whatever they can too, which has been great.
That is awesome.
Yeah.
So I have to actually give a little shout out to Back to Function. Allison helped me with Harper during my first pregnancy, and then unfortunately I had to sub her out while she was on maternity leave and go to Dr. Spencer Bell. But phenomenal. I have been in like probably some of the best shape pregnant, I think, that I can compare, but I haven't been sore. So if anyone needs any help if you're pregnant, I would strongly recommend you coming to the clinic, because it really pays off and it makes delivery a little easier. Allison's going to show me just a little stretch squat for pregnancy, and then I'll try it out. I've been doing it at home, but we'll show everyone just a little tip.
Yeah. So this is a great exercise for pregnant ladies to do. When we are in labor, we do want to use gravity to assist with that, right? We keep hearing that over and over again, that instead of just being on our backs the whole time, we'd like to be on all fours or in a squat position. So I remember too, being pregnant, I really wanted my legs to be nice and strong because I felt like I'd be in that squat position for a really long time. So this is a great exercise that we teach a lot of pregnant patients. You can go up to, the side of the couch, some sort of tabletop like this, and you're just gonna give yourself a nice gentle bend in the knees, and you're just gonna squat down and back. And as always, something that your practitioner may teach you is to also breathe right down almost into your pelvic floor and hold that, and then come back up.
How long should you hold it for?
Couple seconds, 2 seconds, and it's not, you don't have to do a ton of them, but it's just getting, that rhythm down and getting used to that. So maybe 10, 15 a day.
Love it.
Sort of thing.
Okay.
Want to try?
Yes. Right. Good here?
Yep. Nice and slow. Breathing right down to the pelvic floor. Awesome.
A+.
A+.
Thank you, Allison, for joining me for another episode of Working Moms. Stay tuned for more episodes coming soon.
Thanks so much.